Hello everybody, it's Dawne, Seb. We're with the locally world famous chiropractors at Performance Place Sports Care in Costa Mesa. In today's video we are going over an extension tolerant low back today for your sciatica pain. So what is sciatica, Seb?
Well, sciatica is leg pain beyond the knee. A lot of times people will classify it like they'll self-diagnose as, well, but my sciatic area, right? It's not sciatica unless it travels beyond the knee joint. This can be a lot of other reasons for problems, and we do a lot of other videos on deep glute pain, piriformis pain, low back pain. We have tons of videos on these things, but if we're talking about sciatica, we're talking about leg pain beyond the knee. And we're talking about extension-based back pain today, or sciatica today, and we did another video on flexion-based low back, or sciatica earlier. So we're going to do extension today.
We're doing great.
I think we're doing fine. So the reason we're making this video is because there was enough confusion on the last video we made where people were like, I don't get it, I'm more confused. So we're going a little bit more in depth on each one of them with different types and so on. Yep. So we're going to cover two different things you should not do with extension-based sciatica today. Okay. What's the first?
Well, the first thing I think of is a lot of times when we have low back pain, we think of, well, it's my terrible posture, it's this, it's that, right? And so people will sometimes do some lumbar support when they're seated. So they'll put something behind them here that puts them into a little bit of that extension, and then they're just in this extension for long periods of time because their mind tells them this is a good posture. But if you have an extension intolerant low back, you're already driving that irritation being in this extension like this. So you're staring right at me. So maybe we just get a little bit more slouchy into our sitting, or maybe a little bit more of just a hang out like this and see if that actually helps you when you're seated.
Wait a minute. So you're saying that bad posture helps sciatica?
My patient right before this actually told him just get a little slouchy. I'm telling you, it's not, there's no perfect posture for everybody. And if this is something that's driving your sciatica, maybe we just have you here for a little bit when sitting, or just to be a little bit more sloppy.
Yeah, you can almost use pain as your guide in this case. And if certain positions and postures change how your leg pain feels, you can just theoretically just take, okay, that position hurts me more, do the opposite, it might just feel better generally. Okay. I know it sounds simple. It can be that simple sometimes, but a lot of times people need guidance of how to get there. So if you do ever need help, we're around. Yeah. Virtually. The second thing is, what else do people do? We can go over deadlifting maybe.
Sure.
Okay, so deadlifting is one of the things which is a little bit more challenging with extension-based sciatica. So let's push the table aside just for a moment. And this is our sciatic nerve. I'm going to attach it to my foot. Actually, do you want to attach it to your foot? There we go. And there we go. Better camera angle. So let's do a really good deadlift. Okay, so as you can see, Dawne has a nice flat back. Her knee is relatively locked. And so this type of sciatica actually doesn't really like this type of thing because mainly the knee is extended and her back is extended too. So something we can do a little bit easier, and keep in mind this conversation changes if we're talking about weights in her hand. If she had a barbell in her hand, I would not coach her into this type of movement, but go ahead and just let your back go sloppy. How does that feel?
Actually feels good for me.
It feels good for her. Might not feel good for you, but sometimes just letting the back go sloppy a little bit more can be really helpful for leg pain. Or the second thing we can do to take pain out of this movement is go ahead and do that one more time. Can you just soften your knees a little bit? That's probably better on her too, because look, this nerve actually slackened itself. Go straight again. And it stiffened itself. And go ahead and relax. And so the point is if you're tensioning the nerve that doesn't like tension at the moment, then you're just going to aggravate things a little bit further. So the simplest thing to do if we're going to do a deadlifting movement, just relax the knees a little bit. Get out of the idea that it's a proper deadlift or a stiff-legged deadlift or an RDL. Just let the movement feel good.
Yeah.
What else do we need?
I would just say be careful with that one. I think it's nice to see these videos. It's nice to be educated on it, but then trying to go out there and deadlift with a rounded spine or something of that sort, make sure that you're having some guidance in this. There's times that we've done this with people and it helps them really well, but how do you know which one works best for you? So test these things a little bit or reach out to us. I think that it would be nice to be guided through it to make sure it's right.
Yeah, so probably on the note of that deadlifting again. So remember, the deadlift is a movement as well as an exercise. And so deadlifting with nominal weight, no weight, is okay to round the spine. Once you start getting to the point where we're talking about 50, 60 pounds, we're going to have to coach this a different way. The load changes the conversation. So as you said, don't try that on your own. That's something you want to talk to someone about. But how do they reach out to us if they want to?
Well, you can call us, you can email us. Actually, email is probably the best, to be honest. So email us if you have any questions on that, or if you'd like to get some guidance yourself. We are doing virtuals too, so if you want to hop on a video chat and see what's going on, we'd love to do that.
Yep, all of our contacts below. We have videos that come out multiple times a week. All this is free on YouTube. If you're looking for any more videos on random stuff like shoulders and necks and sciatica and foot and whatever, just go to our channel. There's a little search bar and it says, what do you want to look for? And just type in your topic. I guarantee there's probably 5 different videos on that already. So we pride ourselves on trying to put out the best free content on YouTube or the internet. So subscribe, like, share. See you next time.